This is Average Joe PT, and I'm coming to you. We're going to talk a little bit more about the shoulder. Today, we're going to talk about the labrum of the shoulder. I've looked out on the internet, and I'm telling you, I've seen some whacked out people doing some crazy stuff with exercises and saying it's going to help the labrum of the glenohumeral joint, which is this ball and socket thing. Bam! All right, today we're going to talk about the don'ts and the do's, treatments that you can do at home to help labral tears. Stay tuned. All right, folks, I'm not going to bore you too much, but essentially the labrum is this. All right, let's bring it up close. You have the ball, this thing right here where the ball meets the socket. That's your labrum. Essentially, think of it as this part of which is the shoulder blade, comes all the way up, and this makes the socket. And this head is the ball. The problem is the bone part of the shoulder blade, which makes the socket, is very flat. And so obviously a ball going against a flat surface would not work. That labrum essentially gives you this position. So it allows a deepening of the socket. And obviously that labrum is very flexible and rubbery, so it allows that ball to do all kinds of things: move forwards, move backwards, move down, move up. Hence, that's how much we have all these degrees of freedom of movement. That's the reason why you have the labrum. Now, you get a tear in it, all right? Classic case of a labral tear is this. You have pain down in the bicep area. Why? Because the long head of the bicep runs all the way up into and connects to the labrum itself. So when you see people on the internet doing exercises where their arms are out straight, all right, to the front, to the side, that's absolutely ludicrous. You're causing tension on that bicep. You're going to pull on that labrum that's torn and irritate you more. If you can do this motion, whether your thumb is up, all right, or whether your palm is up, you're going to have pain if you have the labrum, all right? When you have that labral tear, that ball is going to move. Let's see if I can put this down for a second. Just pretend my hand is the ball and the socket, the other hand is actually the labrum. When you have a tear, in this case, usually it's on the top, all right? It's called a slap tear, S-L-A-P. You'll hear it all over the internet. It's an acronym for superior, labral, anterior, and posterior. Essentially, anterior is the front, posterior is the back, superior is the top, and inferior is the bottom. It's just some Latin terms, but essentially the tear is on the top and the front and the back. And what happens is that head starts to slide forwards more and back more because it's not stable. You have a tear in there, all right? And the more that ball moves, it's got cartilage on the end of that ball and on the end of the socket part, which is part of the shoulder, part of the scapula, you're going to wear that even quicker than it needs to be, all right? Because you're getting more movement from that tear in that labrum, that ball's moving more than it should, up and down. Good way to get yourself a rotator cuff tear if you don't get that fixed, all right? So there's some things you can do, all right, besides obviously going to see an orthopedic surgeon. But essentially, I'm going to give you some treatment techniques that you can do, hopefully until you see an orthopedic surgeon and they tell you, yes, you need surgery to repair this. Classically, you normally see more than just the labrum is torn. You have probably some fraying. You might have the bursa could be torn or inflamed. Some of the rotator cuffs could be torn or inflamed also. You usually don't just see the labrum torn, though you can just see the labrum torn. But there's no specific exercises that's going to magically stabilize that shoulder. The labrum's not even the same connective tissue as the rotator cuff muscles, which basically make up the backside, what we call the posterior capsule. All right, so I know I'm going on a rant and a rave a little bit, but when I look on the internet and I see these guys, some of these are physical therapists out there saying, oh yeah, if you do some rotator cuff stuff, all of a sudden it's going to stabilize your shoulder enough that you're not going to have, your labrum's magically not going to bother you no more. It's very rare. There's no blood flow at the labrum itself, so it's not going to just, you're not going to heal itself. If it's bad enough and you're getting a lot of movement, you're just causing more problems down the road, possibly a tear, possibly wearing out that cartilage between the ball and the socket. a lot sooner than it should, because that ball is moving more than it should on that socket, because that labrum is torn, moving way more than it should. So I'm going to give you some treatment techniques that you can do, all right, until you see the doctor. Hopefully help manage your pain a little bit, see the orthopedic. Maybe you'll be lucky. Maybe you get an injection. But if you hurt your shoulder and you're having some pain down the front, well, that's one of the classic cases. It could be a bicep tendon problem, yes, but it also classically could be a labral tear. So stay tuned, and we're going to talk a little about some treatments that you can do in your home. Boom. All right, here we go. Like I always say, here we go. It's tape, 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 baby. Tape, tape, tape time. That's right. Good old local McConnell tape. See any of my other videos? Tape it, baby, tape it. And so, how are we going to tape this technique? Essentially, what we're going to do is we're going to take that tape and we're going to do kind of like a V pattern, or Y, depending on which way you want to look at it. So we're going to put one piece of tape and lift up on the back side of you. We're going to take a piece of tape on the other side of the humerus and pull from the front side of you. And then we're going to take a piece of tape and pull from the dead center and lift up on side of you. Essentially what we're doing is unloading that ball so it doesn't have a lot of stress in it. And also we're unloading the rotator cuff too at the same time. So essentially it's a piece in the front to lift up, a piece in the back to kind of lift up, and now you're going up and over, the third piece up and over. All right, and that will do is kind of suspend, kind of hold that ball, maybe take some stress, because that thing, with all your arm weight coming down, it's a lot of distraction. It's pulling that ball down. That's the last thing you want to do, is pull on that labrum more. All right, you don't want to stretch that thing out more. It's going to irritate it more. Initially, you might feel a little bit better because you're pulling away from the tear, but you're also pulling that ball away more, and that's not a good thing to do. Best thing to do is take, like I always say, magic towel. Take the magic towel, put it underneath your arm, all right, or maybe just rest it in a recliner chair. Excuse me, getting over a cold, or rest it in a lounge chair, or like for me, and rest it like this. All right, so that will at least help it a little bit. So, towel and magic tape. The third one you're gonna do, ice. All right, you want to ice it. It's gonna get inflamed right up along this area. Like I'll below at the end of this, I'll give an attachment to my other video that goes over the injection, what they might do. Some symptoms of rotator cuff involvement, which is kind of referring down the side of the arm. That's from another video I did, so you can go ahead and look at that one after this one if you'd like. And I'm having more content coming, so subscribe down below, ring the bell. But those are three main things: taping, positioning to unload the shoulder, all right, and then icing. Those are three comfort things. Obviously, your doctor might give you some anti-inflammatories and stuff like that. If you go to your primary care doctor, before they probably send you to a specialist, or maybe they'll do an MRI, or maybe they'll send you to a physical therapist first, and the physical therapist will do a couple orthopedic tests to see whether you have a rotator cuff or labrum involvement. And there's a couple different tests that we can do that will give us an idea. I mean, the definitive is a contrast MRI where they put dye in, then they do the MRI, so it kind of lights up the actual labrum area to see if you actually have a tear or not. So those are three treatment techniques you can do. I guess you could do four. If you want to do the towel like I do for the posture and the neck episodes, you kind of put it back there like I've shown you in the past. I kind of just hold it there. That'll kind of naturally rest your shoulder back versus without the towel. So you kind of hold back. That will also help reduce some of the stress on that labrum too. So you can always do that for positioning as well as underneath your elbow. So those are 3 or 4 treatment techniques that you want to do if you hurt yourself and you're having pain in the front. You might even having some radiating pain on the side before you see your primary care doctor. All right, but if you have any of those signs, excuse me, you better go see the doctor. All right, don't think it's going to go away, because it might calm down, but then you go ahead and do something again overhead and boom, it comes right back there again. So that gives you an idea. Pain in the front or pain on the side, go see your primary care doctor, then get you to see a physical therapist. All right, but those are some good treatment techniques that you can do until you at least see them to keep your symptoms calm. So, all right, so we're going to wrap up this episode about labrum and tears. And like I said, 3 or 4 treatments that you can do till you see your primary care, and then refer you to a PT or an orthopedic doctor, so where they can do more imaging. So, like I always say, if you have any comments, put them down below. All right, put them down. Ring the bell. Subscribe. All my people, all my subscribers so far, thank you for sticking with me. I'm going to keep bringing you content. I probably will do, unless someone brings up another topic they want me to talk about, I'm probably going to talk about the hip next time. So that's 2 actual episodes about the shoulder. I'm going to bring you the hip next time. All right. And we'll kind of go over some different types of hip exercises and hip pain treatments and stuff like that you can do on your own at home to reduce your symptoms. Until next time, look up and keep smiling.